grandmother, laying in bed, slowly forgetting everything about her life, forgetting everyone she's ever known and everything she's ever loved. 2 years prior to this situation, she was offered an experimental medication to treat her dementia. The copay for this medication was $6,000. On her fixed income, she couldn't afford this medicine, so she had no choice but to lay there and lose every memory of her life. This situation is something that elderly people deal with every day. Insurance pricing has a much larger impact on the elderly than many people realize. Longer life expectancies, high insurance prices, and limited income make insurance for the elderly a difficult, if not impossible, feat. Longer life expectancies create a challenge for the elderly to obtain insurance. According to the CDC, National Health Center statistics, life expectancy has steadily increased in the past 10 years. It's also expected to continue to rise for eternity. After 65, insurance is much harder to obtain and much harder to afford. Elderly people can afford insurance most of the time. According to Lindsay Smith, an insurance agent, most clients over 65 are living on fixed income such as Social Security. Social Security statistics detail that monthly maximum for an aged couple receiving Social Security is $2,260. A single person receiving Social Security receives $1,360. The average monthly health expense, according to Katie Lee Bosco at CNN, is $580, but most elderly people pay double that. So that means elderly people are paying over half their income for health care alone. It's no secret that elderly people have high insurance premiums and copays, way higher than younger people. Insurance premiums are dramatically higher for the elderly. Elderly people can be denied due to illness, such as heart disease, cancer, or respiratory disease. Those are the three leading causes of death for elderly people, and actually anyone in the world. Healthcare costs are projected to rise dramatically over the next 20 years. Average Medicare premiums between the ages of 65 and 85 is $267,000. Those are the retirement years. There are currently a few programs available that offer assistance to elderly people. The main one that people are concerned about is Medicare. Most elderly people use Medicare, but there's several other ones. Medicaid, which is a low-income one for elderly people or for low-income families, is used. Medicare is available if the senior worked 10 years and over 65. It doesn't cover long-term care, dental, or vision, and only covers hospice if the person has 6 months or less to live. The main problem with Medicare is the fact that it costs $267,000 over the 20-year span that people retire. When people are starting to retire, they're told to invest or save $250,000 for the span of their retirement, and the Medicare premium proves that you're going to spend that in health care alone. Private insurance is most of the time too high for an elderly person living on a fixed income to afford, has a high cost premium, or they could be denied coverage in general. You think that this won't affect you because you're not elderly people, but it does. Elderly insurance pricing affects the U.S. economy by a shocking amount. A substantial percentage of the U.S. economy is spent on elderly health care. 5% of it, exactly, is expected to double by 2030 and expected to triple by 2050. That means by 2050, 15% of our entire economy will be elderly health care. As you can see, insurance pricing has a devastatingly negative effect on the elderly. Many of our tax dollars goes towards funding programs that don't offer as many services as you would believe. But, as everything, there's a solution. These problems can be solved by creating personalized insurance policies for the elderly based on their income and needs. They can tailor policies and only pay for services needed. The solutions proposed to lessen the impact of insurance pricing for the elderly can also be beneficial to you. Less taxes would be required to maintain current programs, more time with loved ones who are receiving the health care needed. The life expectancy will continue to increase and people will be able to be taken care of during that increase, and it would be a less financial burden on the family. As you can see, insurance pricing has a huge impact on the elderly. Action needs to be taken to provide the elderly with affordable choices for insurance. Tailored insurance policies are a great place to start. Not only would it assist the elderly, but it would also save you money on taxes for government programs. And who doesn't want to save money?